The countries that have very poor performance on health expenditures actually seem to do pretty well on the pension side, and vice versa.
The big advantage of the European Union, and I think something we don't appreciate fully, is that we are the only region in the world which has the structures and the mechanisms and the tools to act on any problem at all levels, whether it's political level, technical level, expert level, administrative level. We have the structures. We have the tools to do it if we choose to use them.
We will ask our local communities, local cities to introduce many instruments in urban planning, in transport areas, in keeping eyes on a clean environment and air pollution, all things, because cities play enormous game addressing demographic challenges.
Well, health is a political choice. And if we imagine health in terms of a river, we want to give people the ability to swim and be above the waterline. So we need to invest in health promotion, prevention, and give people the ability to live a long and healthy life. Instead, we are wasting our time and money in curative services when people are already at the edge and falling over the waterfall.
There are several things that Europe can try to do to face this emerging phenomenon of the aging society. So one of these is definitely making the study of gerontology a bigger topic in medical school, implementing more clinical trials for over 75 people, while now like the 99% of clinical trials are focused on people in the range of between 18 and 65. Europe should promote the implementation of treatments at home. We should reduce the need of people to go to the hospital, while we should bring health in their own home.
We have a lot of data on mother and children's health status. We have information on mothers separate and children separate, and we don't have an integrated picture of how that plays out for mothers and children. So what we would want, because childhood is really the moment where you're building the blocks for future lifestyle choices, is have information on how children are doing in their family, how they're doing at school, how they're interacting with their peers. We want to have data in general that's closer to people's real life experience.
There are gaps in our systems, lack of accountability and reliable data, slow implementation of evidence-based practices, skyrocketing C-section rates, and these will all inevitably lead to increased maternal mortality. We're far from finished, and we are far from perfect.
These new demographics are what we see now with refugees and the migrants. And last year we focused on refugees, but those refugees are now migrants because they stay for some time with us. They will stay with us. So they have to adopt to the health systems, and the health system have to adopt to them.
But the brutal fact is, if you're talking about a migrant who isn't allowed to work, death is the ultimate economy. Like, yes, it is cheaper to provide preventive and primary care than it is to provide tertiary care, but you don't have to provide anything.
I still believe that we cannot have persistent growth without the arrival of new opportunities and new people, and I'm worried about the fact that we still have Europe as a collection of national research systems.
Whatever fiscal challenges we may think we face over the longer term in paying for healthcare, retirement, the immediate problem right now is just plain getting full employment.
The way most of our urban environments are designed, they're not very age-friendly at all. Well, that's a great area. Adaptation of housing, for example, is an area which could create a very strong economic stimulus and improve the prospects of independent living for a longer time.
The hardest part is not how do we manage things in the year 2030. The challenge is how do we handle things between now and 2020? How do we get out of this low inflation, low growth trap that we're in? And the solutions are not intellectually hard, but they're politically hard to do.